This virus is actually a novel coronavirus. In the past, there have been two other mutated coronaviruses which have caused pandemics. One was the SARS, which was in 2002, and the other was the MERS, which was in 2012. To give you a comparison, the SARS, or the Severe Acute Respiratory Syndrome, which was caused by a novel coronavirus in 2002, had a mortality of 10%. The MERS, which is the Middle Eastern Respiratory Syndrome, which came out in 2012, had a mortality as high as 35%. Now, the current SARS-2 coronavirus, which causes the COVID-19, has a mortality in the region of about 2 to 3%, probably more likely 1.5 to 2.5%. Now, apart from this, if you need to compare it with the common flu or the H1N1 or the influenza A, the information available so far tells us that this is probably a little more infectious than the flu. To give you an idea, when we say infectiousness, we use a terminology called the R0, whereby we refer to what are the chances of an infected person transmitting it to others. And the chances of one infected person with COVID-19 can transmit it to about 1.5 to 2.5 people. To give you perspective, measles, if one person can get it, is likely to infect anywhere from 12 to 18 people, and chickenpox, one person can infect to another 6 people. So that tells us that measles is highly infectious, and chickenpox also, and compared to that, the COVID-19 infection, the infectivity is much lower, only 1.5 to 2.5, and the regular flu is infectious probably in the region of about 1.5 or so. We also understand, when we compare it with the flu, that the incubation period for this COVID-19 is a little longer. The flu, generally the incubation period is 2 to 4 days. Here, an average of 4 to 5 days is the incubation period, but can be as long as 14 days. Also, flu, the persons have fever, body pain and cough, which is also quite often seen with this. But in flu, we also have a lot of people have upper respiratory symptoms in the form of cold, blocked nose, runny nose, which is less often seen with COVID-19. It has been shown that almost 3% of people with COVID-19 have diarrhea, which is a little more often seen when we compare it to the regular influenza A. So, the practical message is COVID-19 and flu are very similar in terms of how they are acquired, which is through respiratory droplets and touching inanimate surfaces which are contaminated by a person's coughing or sneezing and then taking our hand near the mouth or face. The symptoms are similar. The mortality is probably a little higher. With common flu, the mortality is about 4%. With this, the mortality is in the region of 2 to 3%. So these are the only differences. Now, the disease corona SARS-2A COVID-19 is a self-limited condition. The incubation period, that is the time from the onset of exposure to the occurrence of the disease or the symptoms, is about, I told you, median of 4 to 5 days, but can vary anywhere from 2 days to 14 days. The person presents with cough, body pain and fever. Almost 80% of infections are mild, does not even warrant hospitalization. Another 15% may require hospitalization for oxygen and other supportive measures. 5% of people, that is 1 in 20, may end up in the ICU requiring ventilatory support, out of which about 2 people may die. Those who die are typically elderly people over the age of 60 or people with other comorbidities like diabetes, heart disease, lung disease or kidney disease. It has been shown that the mortality can be as high as 15% in people over the age of 80. So at present, if you develop symptoms, we advise what is called home quarantine. This home quarantine is advised in 2 situations. One, if you have come from a country where there is a local transmission of this infection, like in China, Iran, Italy, Germany, France, and probably some other countries in the near future they may report. So if you are coming from any of these countries, you don't have symptoms of fever or cough, you come to India, for the next 14 days it is advised you stay in home quarantine. By home quarantine, I mean that you need to stay in a separate room which is well ventilated with the doors closed. The person should not entertain any visitors and even the family should be at least 1 to 2 meters away, the distance apart from this person at all times. The person should not leave the house, should not go anywhere for any social gatherings, for school, or even to social functions, which means he should be entirely at home isolated. The toilet which he uses should preferably be dedicated for this person alone, but if you don't have facilities for a toilet, he can use the general toilet after the others use it, preferably. This person should wear a blue triple layered mask at all times and preferably hand wash or use hand sanitizer frequently. It is also necessary that the mask which is worn by this person is not handled, should be disposed of in a bin, and ideally should be incinerated or subject to deep burial once the person has used it. A person can use the mask generally for 4 to 5 hours, beyond which it may become moist and become ineffective. So these are the things you need to keep in mind. At present, there are a lot of people who present either after they have come back from a country where it is prevalent but don't have symptoms, or there are some people here who have symptoms but no exposure to a proven individual with COVID or exposure to any countries where COVID has occurred. Now, as I told you, the tests are done only in government centers and the public health machinery decides who needs to be tested. And the test is currently reserved only if you have come from abroad and are symptomatic, or you are symptomatic with exposure to a proven COVID-19 case in India, which means if you are anxious or if you may have symptoms of fever, cough and cold with no history of exposure to a patient or no history of travel, the test will not be done. I don't know how this will evolve in the next few weeks, but at present, the Public Health Department decides whether you need to have the test done, and they are reasonably strict and go by the WHO definitions, which means that you either need to have been in a country where it is prevalent or come to India within the last 14 days, or you must have been exposed to a proven case of COVID-19. There is a lot of wishful thinking that the heat will kill the virus and the virus will cease to spread once the summer sets in. Now, I am not very confident about this. The virus survives very well at the body temperature of 37 degrees. And if I cough or sneeze and another individual happens to inhale it directly, temperature outside is immaterial. It goes directly from one person to another. But if I cough or sneeze on a substance or an inanimate object where the ambient temperature is very high, more than 30 or 35, the chance that this virus will survive or be viable for longer than a few minutes or even a couple of hours is possible. So, in a hot temperature, ambient temperature, if it falls on an inanimate object, it will dry very fast. So, transferring from one person to another through a medium will be less likely. But having said that, we need to realize that most of the transmission happens indoor, where inevitably the temperatures are much lower and there is air conditioning. So, which means within an office, within a department, within a hospital where the temperatures are all in the region of 20 to 25, the concept of a hot summer doesn't make a difference. So, all of us need to take adequate precautions. Only outside where the temperature may be hot, the virus may not survive for long, and this may probably take the edge of transmission in the outside environment. Flu vaccine is only protective against the circulating strain of flu, because the flu vaccine virus is also very mutable virus or keeps changing every year. Depending on the circulating strain of the flu virus, you need to take your vaccine as a booster every year to prevent yourself from getting flu. This has no connection whatsoever with the SARS virus, and this will not help protect you against the COVID-19. Based on our experience in the past several decades, in general, if you get a virus infection of a specific strain, you get lifelong immunity to the virus, whether it is chickenpox or whether it is measles or whether it is mumps. I would expect, now there is no scientific evidence, but I would expect that for this strain of SARS-CoV-2 or the COVID-19 causing virus, if you get the infection once, you should have immunity which probably will last a lifetime. Similarly, if you have a vaccine which is specifically targeted against this strain, you should get immunity. But whether this will happen, whether the virus may change in subtle manner which can cause a person to be reinfected, we have to wait and see. If there is local transmission proven, for example, in India, we start getting people who have never traveled, who have never been exposed to a proven case of COVID being tested and proven that they could have this COVID-19. Yes, it means that we have to be careful. The general advice we give for everybody is avoid all non-essential travel, avoid all crowds. Please do not wear a mask outside if you are public without any symptoms. If you have symptoms, wear a mask and stay indoors, self-quarantine. So which means if you have some symptoms of cough or fever, even if you are not sure it is COVID, it will be safer to stay indoors, avoid crowds. Apart from this, wash your hands frequently or use a hand sanitizer, especially in public places, and avoid taking your hands near your face. These are simple measures. I expect that probably this epidemic or pandemic may last another 2 to 3 months, at least in India for the next 2 to 3 months. I think all of us need to be safe. We need to ensure that we take personal responsibility for this, and which means that if you have symptoms of cough or fever, irrespective of what it could be, please avoid going to work. Please avoid sending your children who may be having fever or cough to school to protect others. So civic sense and personal responsibility is paramount at this point. If it means social isolation, yes, all of us need to stay indoors so that we don't spread the virus and transmit it indiscriminately to others, especially old people who may not fare well. Thank you.